Justin Astina, the chairman of the House Freedom Caucus, says the current Senate health care bill, quote, does not have enough conservative support in order for it to then pass in the House. Meanwhile, many opponents of the Senate bill are concerned about cuts to Medicaid. Medicaid is the health program for the poor and low-income families. It is also one of the plans that President Trump promised not to touch when he was out and about on the campaign trail.
Save Medicare, Medicaid, and Social Security without cuts. Have to do it. Get rid of the fraud, get rid of the waste and abuse, but save it. People have been paying in for years, and now many of these candidates want to cut it. I'm not going to cut Social Security like every other Republican, and I'm not going to cut Medicare or Medicaid. Every other Republican's going to cut. And even if they wouldn't, they don't know what to do because they don't know where the money is. I do.
So if you are fortunate enough to have a full-time job or receive insurance through your employer, Medicaid may not be something that really stands out to you. But just let me show you some numbers. Because Medicaid covers half of all births in this country, 60% of all children with disabilities, and 64% of all nursing home residents. So with that, Rick Newman is with me. He's a columnist for Yahoo Finance and has an article out today called Trump Care Fixes Nothing. So nice to see you again.
Hey.
Just to underscore for me why this is how this affects so many people in this country.
Yeah, because there are a lot of people who don't get health coverage the normal way, which is mainly through an employer unless you're 65 or older, in which case you get it through Medicare. So if you don't get it one of those ways, what do you do? Especially if you're lower income, you can't afford it. That's what Medicaid is. It's funded jointly by the federal government and by states. The feds put in about 60%, the states put in about 40%, and this was expanded under the Affordable Care Act, or Obamacare, back in 2010.
Right.
And that's what the Republicans are going after right now.
So it was expanded, to your point, let me just walk everyone through this. It was expanded under Obamacare. Both the House and the Senate versions of the bill extends that expansion, and it reduces the number of people who qualify for Medicaid by allowing states to impose cap enrollment or a per capita cap. How does that work?
Well, we don't know how the details of the Senate bill are going to come out, but the Senate bill is similar to the House bill. So the Congressional Budget Office told us that the House bill would cut about $880 billion over 10 years, so call that $88 billion a year. Total funding for the program at the federal level now is about $350 billion. So that $88 billion would be about 25% of all federal funding for Medicaid right now, and that's a lot of money, and that's why the CBO found the House bill would put about 14 million. It would take health insurance away from about 14 million people who would otherwise have it.
Then what? I mean, if they take it away.
That's a great question. Then what? So the idea is that the Republican idea is they're going to try to make adjust the incentives and subsidies for people to do something like Obamacare, which is get some help from the federal government to buy insurance in the private market, whether it's through something that looks like an Obamacare exchange or just on the private market. I think the problem is that it's still going to be very expensive. It'll just be too expensive for a lot of people. And we do know, and they also want to get rid of that mandate that you have to have insurance. So a lot of people probably will say, I'm just going to skip it. And then what's going to happen is what happened before we had the Affordable Care Act, which is if people get sick, they go to an emergency room, they have to be treated anyway, even if they don't have insurance, and somebody has to pay for that, and that generally gets passed through the system, and insurance rates kind of go up for everybody.
Right.
That's how that gets paid for.
And that is just one piece of this, Rick Newman, thank you so much. Another piece of the Senate health bill, a provision to defund Planned Parenthood for 1 year. That could be a sticking point for two senators, Susan Collins from Maine and Lisa Murkowski of Alaska. These ladies say that they will introduce an amendment to actually remove that piece out of this bill. CNN senior medical correspondent Elizabeth Cohen has a look at how the funding cut could impact one expecting mother in California.
After suffering infertility and 3 miscarriages, Ariana and Kevin Gonzalez were thrilled when Ariana became pregnant with daughter Bailey. But they were worried, too.
We needed to make sure that this pregnancy was going to stick and it was going to be healthy. And in order to do that, off to Mexico we went.
That's right, off to Mexico. That's because the Gonzalezes live in El Centro, California, in a county federally designated as a medically underserved area. Ariana has health insurance through her job as a high school teacher, but there simply aren't enough doctors to go around, and so she was going to have to wait 6 weeks to see her obstetrician. That's why Ariana was relieved when a Planned Parenthood clinic opened in her town, filling the void. But now, she's worried all over again.
The ayes are 217, the nays are 213.
Because the American Health Care Act, passed recently by the House of Representatives, defunds Planned Parenthood. The new Senate proposal would do the same. That could force her clinic to close, the clinic where she gets birth control and gynecological care. And if it closed, she'd be right back where she started. If your clinic closes down, you would leave your country.
Yes.
To go get care.
Yes. And I know people might be thinking, you know, that's a little bit drastic, and it is.
She doesn't want to leave her country to see a doctor and face this long line at the border. But right here over the border in Mexico, there are plenty of doctors ready and waiting to see Americans. Republicans say Ariana shouldn't worry. She'll have ready access to care in the United States. Because while the health care bill takes money away from Planned Parenthood, it provides $422 million to beef up federal health centers like this one in her town that don't provide abortions.
For every Planned Parenthood, there are 20 federal community health centers. They're vastly bigger in network. There are so many more of them, and they provide these kinds of services without all the controversy surrounding this issue.
But many experts say community health clinics can't fill the void that would be left by Planned Parenthood closures, that they simply don't have the capacity. So now Ariana has a message for senators before they follow the House and vote to defund Planned Parenthood.
If their doors are shut, you'll be driving your own constituents to an entirely different country in search of health care. And that's not America. Yes.
She says she hopes and prays that senators won't send her away from her own country to see a doctor.
I think it's shameful, and I think that they should be embarrassed.
Elizabeth Cohen, CNN, El Centro, California.
Elizabeth, thank you. Coming up, Johnny Depp